Hello, I'm Jason Ashe. I am a rising third year at University of Maryland, Baltimore County, in the Department of Human Services Psychology. I am studying community psychology and behavioral medicine, and my research interests are looking at the intersection of religion, race, and discrimination, and how that has effects for cardiovascular risk disease, particularly in African Americans, but across white Americans as well. When I was in seminary at Duke University Divinity School, I served as a chaplain intern at the medical center, and I was working with patients who were suffering from respiratory disease, and I was also stationed on the labor and delivery unit. And specifically, one patient in particular that really struck a nerve was I entered into the room. And I met this older African American woman who had just suffered a stroke. And as many of us may know, stroke is a debilitating condition. And so she was unable to actually communicate with me, which, as a chaplain intern, felt uncomfortable for the first couple of moments, just because, language is essentially how we are trying to communicate, specifically because I'm assessing her spiritual needs, right? And so if she's unable to speak those, it's hard for me to gauge exactly what it is that she might need or just want in the moment. And so I essentially sang a song to kind of break the awkwardness of it. I asked her if it would be okay to sing a hymn. She nodded with her head and she started to cry. And so after I left and I talked to the nurses just about, what has her social support been like since she's been here? The nurses were they're very quick to say, yeah, her family's been in and out, but she's really been here by herself. And it really dawned on me that in that moment there was a dimension of healthcare that this woman was not receiving, that was transformative for how she was going to be occupying this space. I felt like there was a connection with regard to how religion really mattered in that moment, because what she needed was, in some way, shape, or form, a reminder that her faith journey was still going to be impactful while she was in this space, and while she was unable to speak some of the thoughts that a lot of people have when they're thinking about their illness in their moments. Particularly leading up to death, but irrespective of the moment, just knowing that a medical crisis is hard to deal with. And so when you're trying to think about and sit with the condition of your soul and your spirit, and knowing that you can't communicate that in the moment, that really was a driving force for me to think about that there are certain populations that really rely on their religion in these moments of crises. And if our healthcare system is not fully understanding and wrestling with how it is that we can provide the best care possible, then we're not going to really be moving towards the fullest possibilities of healing and treatment and care. And so that moment in particular, and there were others, but that moment in particular really showed me that certain populations need their religion to be honored and respected while also receiving health care. A culture of health to me means that everyone has equitable access to healthcare services. Everyone has the opportunity to live this life without systemic oppression, feeling othered, feeling marginalized, feeling disenfranchised. Those are really big words that academics use to essentially mean that we want people to live their lives without any experiences of unfair treatment. We recognize that the society in which we live has a history of unfair treatment, and that is intertwined in our policies, it's intertwined in our language, It's intertwined in it's as subtle as the ways that we look at each other when we're passing each other on the street. And so, if we can really diminish those experiences of feeling less than an other for simple reasons, um, for physical characteristics, personal characteristics, if we can move our society away from those experiences and moving towards a society of morality, compassion, and everyone knowing that fairness and justice is a right, our rights that we all should experience, that would be a culture of health, because in essence, all of our social institutions would fall under the framework that everyone in this world has a right to live and to be as free as they are, who they are, and navigate this world without all of the other small or big cuts that would impact their mental and physical health. So my research is explicitly looking at the ways that American Christians think about and talk about um, God as a healer, and in particular, in the Christian narrative, we often talk about the religious figure Jesus Christ as the great physician, and so there are different historical and societal factors that would shape how we would think about those figures and those ideologies differently. Um, and so when we are now trying to incorporate healthcare practice that is holistic, healthcare practice that is equitable, we also want to be mindful of the ways in which that our healthcare settings and our systems are diminishing the stories of um, African American culture, and in particular how that intersects with Christianity in the moment of receiving healthcare. And so, if there are certain ways that African American Christians might be speaking with their healthcare providers, and for an example, if the healthcare provider says there's nothing else that we can do for you, and then you might hear an African American Christian say, well, when the doctor says no, Jesus can still say yes. There's a moment where in both of both of these persons, there's a shutdown, because it feels like there's an exhaustion of options, right? Recognizing though that our healthcare system is operating in a society where some of these sayings and some of these these beliefs are really rooted in the connection of discrimination, medical mistrust, unfair treatment in healthcare, unfair treatment outside of healthcare. If we can really move to have physicians really understand then that we are trying to touch the lives of people who are trying to understand the news that they're receiving from physicians, the news that they are receiving from their healthcare provider team, and then match that with the cultural factors that have shaped them to say, this is why I'm here now. We need to really be putting our conversations and policy then in a cultural framework that is also understanding why it is that we've even gotten to this space. And so this may not be particular to the yes, but I do believe that this understanding can start here because of the unique history of race and racism, and how we are always navigating these spaces differently as a function of the everyday experiences that we have with race and racism. And so that is kind of how I'm hoping to change policy with regard to the training of healthcare providers and physicians, so that we are truly providing a holistic care outside of the biomedical westernized framework. One thing that I have really grappled with is that when you start a PhD program, particularly for many of us who come from underrepresented populations, we tend to think of the PhD as a weapon that we will be able to really combat some of the societal systems that keep many of our communities that are dear to us down. And then when we're in our programs, we are daily hit with microaggressions or our own imposter syndrome show up. And then you also hear this overarching theme of, well, you're not going to be able to change the world as a single person. The PhD is not going to help. Don't try to do that in grad school. I think what is most striking, though, about HPRS is that we have now been introduced to over 100 other people who share similar experiences and also goals of changing the world and doing it radically and hopefully very quickly.